Rahmatullah. I will talk about nursing practice standards in simple way. When you buy product like this or foam, you want good quality product, so it will last for long for you. And when you buy a car, how you know it's good product? How do you know this product is good? Because you will pay your money for this product, and you didn't use it yet. You don't have no experience using this device, new device for you. But how you choose the correct or good quality device?
Review.
Huh?
Review.
Review, ask others. So others' opinion, what else? Huh?
Quality.
Quality. How you know it's a high quality?
Evidence.
Huh?
Evidence.
Evidence, yeah. Like what evidence? If you have by phone, it's inside the box. You can read in the box the manufacturer, the standards, made in this country, right? You know the brand itself, all people using it. So this brand always produce good product. How this brand produce good product? They have standard. So what product do we produce? What product nurses produce? Care. So our aim is to have high quality care by having standard. So standard should not be difficult word or theoretical, should be practical. Now we will learn the definition and purpose of standards, nursing standards, why they are important, how to apply them in nursing process, and other nursing practice standards. The standard is a statement or expression for what is normal, accepted practice, range. Example, you want to give your medication. Your medication is due at 8 a.m. You give it at 7:30 or 8:30, okay? Accepted? But if you give it 9:30, not accepted. So you have time limit between and after. So this is the range. And this is the good practice. Within this range is a good practice or the accepted practice. And also it's a benchmark, so target to achieve. We want to have excellent practice. How we know it's excellent? We have to compare against standard. Then it helps us in assessing ourselves and producing competency. So competency, for example, to make sure all nurses do the procedure in according to standard, or once they do it in this step or this technique, it will be safe to patient, save time, save resources. So this is the reason why we have competency, to make a standard practice, standard technique for all nurses in the institution. And also it will help us understand or others understand our role. It will differentiate nurses' role from physician role, from physiotherapy rule, nutrition rule. So once you have a standard, this is my work, this is my job, clearly. So the standard will help you to do that. Then let's apply it to nursing process. You know the nursing process, which is a cycle. It's not a linear process, it's a cycle process. So first thing is assessment. How to conduct assessment in a proper way? Must have a structure. You must have a structure. How we are applying structure to assessment? Structure means standard. So you have four pain assessment. Include location, pain scale, radiation, triggering factors, relating factors. You do this assessment, your colleague also will do the same. Next shift will do the same. After 10 years, we'll do the same. So this is a structure. And it will be comprehensive in detail. All assessment related to pain. As location, severity, triggers, all this in detail about the pain and focus. And based on patient need. Based on patient need. You ask the patient, does he have pain? No. Once the patient said, I have pain, and he put the pain rating scale more than 4. According to our policy, what you will do? 4 or more. Pain, 4 or more. What is our duty as nurses to do? Inform doctor. What else? Provide medication. Do the comprehensive assessment. Here you will have to document location of pain, severity, intervention, relieving factors, try pharmacological intervention. Okay, so you have comprehensive. Once the patient have, okay, I have pain or new pain, you have to initiate this assessment form. So the standard are said, if the patient have new pain, you have to start this form. If the patient have increased the pain more than four or more, you have to initiate this form. So this is a standard and this is a process, and it will be according to patient need. Ongoing process means we assess the pain every 4 hours, and once we have intervention, we will assess according IV after 30 to 45 minutes, and for oral maybe 1 hour. So you have also standard for that. Those the policy will make us our standard for assessment. Next thing is diagnosis. You now diagnose the patient having pain. From where? From your assessment. And you know this pain related to or in location like that. You know description of the pain. And you inform the patient with your finding. Why? To involve the patient. Must involve the patient. Don't leave the patient as an object. Patient is person. So you speak to the patient, okay, I found out you have pain in this location, and he will, just why he not need to know that this is your diagnosis? He will, if he disagree, if the patient said no, not like that, means, what does it mean? If you said, okay, you have pain, you told the patient, okay, I found out that you have pain in this location, and the score according to pain scale is so and so. And he said, no, it's not here, it's here. What does it mean? You have to do again assessment. You have to correct your statement. So, you have to correct your statement. Maybe you put wrong intervention. Then the outcome, you have means what goals from your plan. The goals has to reflect what you need to achieve. Let's say reduce the pain from 7 to below 4. This is measurable and has to be realistic. Patient paralyzed. If you want to mobilize patient who is paralyzed, can be gradual. You cannot plan to mobilize patient who is paralyzed for 1 year to mobilize within 2 weeks or 1 week, right? Or in short time. So it has to be realistic and also validated with patient and individualized to patient. So don't make a plan copy paste. Must see patient need. Each patient is different. Same things we apply also to and we make the interventions in the plan. So the interventions has to be also according to patient need. It has to be individualized. It has to be following rules and regulations. So our policy sometimes mention the intervention for some nursing problems. So you follow these interventions. Some interventions not allowed or not accepted. Like for example, if non-Muslim country, they are allowing patient to drink wine. We are not having this here. I give this as example. So you should be aware of your policy, what is allowed, what is not allowed. Okay, and maybe you have to write it also in a clear language so others will understand. Once the people, after you come and receive the patient, they understand what you plan, so they can continue. You must ensure patient safety. Patient safety. In intervention, fee desired effect and what? Desired effect and side effect. Effect that you want and effect that you don't want. Example, you may give medication, it may cause nausea, right? You give it for pain, but it causes nausea, cause abdominal pain. Or you give cold compresses for fever, it causes discomfort and chills and shivering. So this is side effect. You should consider patient safety and document all responses and utilize all available resources. So for fever, you can give medication, you can use cold compresses. There are devices, like cooling devices. So you see what available resource. I know this is all common sense, but we are just reviewing together. Coordinate the care. You can work with nutrition department, physiotherapy to achieve. Nurses is part of team. Not only just you finish care. No, you can ask physiotherapist, nutritionist, what should I do with this? Of course, doctor. And teach also relative, because that's why you teach the patient, teach the relative. So the patient will do breathing exercise, patient will cooperate, range of motion, in the range of motion exercise, etc. in his diet. Then last thing is implementation, evaluation. Why we need to do evaluation? How effective our intervention? Do we need to change? Do we need further to continue or repeat again or like that? And also, it should be same like assessment. Why? Why do you think our evaluation should be the same like the assessment phase? Example, if I use pain scale, certain pain scale like verbal pain scale in the assessment, and I choose different pain scale in the evaluation, numbers will be same. The numbers, it will not be same. You must be used, if you use, I will make it more clear. Temperature, you measure Celsius, fever in Celsius in the assessment, but you measure fever in Fahrenheit in the evaluation. The numbers will not be same, right? So you have to use same method here and after, before and after, to compare. That's why you need structure, you need standard. And you use a criteria to check off this done, this finished like that. And also you have to involve patient. So now, okay, pain reduced, or if the patient have electrolyte imbalance, no, now potassium become normal. You have to involve and inform the patient. This is the nursing process standard. There are now other group of standards. All nurses are required to abide by. First is accountability and responsibility. Why we say and? Why responsibility and accountability, two words? Why we don't say only responsibility or accountability? What's the difference? What's the difference between accountability and responsibility? What do you think? Can a person be accountable? Can a person be responsible and not accountable? Or can a person be accountable, not responsible? Can a person be responsible and not accountable? Can be? Who think yes? Responsible but not accountable. Who think yes? What do you think? Yes or no? Yes. Can be. Responsible and not accountable. What do you think? Cannot. Cannot be. What? Yes or no?
Yes.
Can be responsible, not accountable. Okay. Cannot be. He cannot be responsible. He can be responsible, but not accountable. And must be, huh? Okay. Yes. He can. Just responsible without being accountable. Can be, right? Yes or no?
Yeah.
What do you think? Yes. You think he cannot be responsible without being accountable? Huh? He must be both. Cannot be responsible without being accountable. Cannot. Okay. Type. Who think yes, he can be responsible without being accountable? He means there are two phases, two stages. Stage 1 responsible, stage 2 being accountable. So you reach this phase, maybe not reach the second phase, or second level, but the one who think responsible and accountable must be together means they are same level. So if you take this package together, so you agree with me?
Yeah.
Type. Think about this. You are responsible to care for your patient, to monitor your patient properly, position your patient, suction your patient, do hand hygiene, administer medication within 7 rights, according to 7 rights, like this. You should, but you can not do that. Sometimes, maybe, some people will not do that. So if the person must do, but he didn't do, is he accountable? Huh? No, he is not.
No.
Because accountable means he must do. So either by force someone and open the file, no, you didn't do this one, you must do. Or he feel he must do. So can be from inside, or can be someone outside that force him. Can be the system itself, he will have violation, or can be from inside. So, but once maybe he will not do his duty. So maybe he just signed, he will not give the medication, but he is still responsible. That's why he is mistaken when he not do it. He didn't give it. How come he is accountable? Accountable he means carry out the responsibility. So this is we want now to have the accountability. So we are responsible to learn our scope of practice, and so you are in oncology, you know what job you have to do, and do it in evidence based. You have to read, you have to find the policy related to your work, and you have to judge what's right for your patient, when to inform doctor, when to give this medication. So PRN medication you can give according to your judgment. And you have to be competent. Competent is not others also judgment, but it's yourself. You can judge yourself. Am I competent? Maybe you didn't insert cannula for a long time. Are you still competent to insert cannula or no? You can think about this for yourself. And also responsible to document, participate in quality improvement, and take action. So if you harm going to a patient, someone going to cause harm for the patient, you must remind them, you must stop them, as our job as patient advocate. Evidence-based, simply knowing where is the source of your the base, the supporting knowledge for what you do. Why you do hand hygiene 5 movements? Okay, there is infection control guidelines. Why you do it in this time, in this technique, right? Why you have to clean for 15 seconds for the cannula? You have to know where is the source for this information. And also, you are responsible for professional relationship. Professional relationship, we must maintain it, because as nurses we deal with all the team, physicians, other nurses, other discipline, patient, family, our colleagues. So we must have a positive relationship, productive, by good communication, by respect, by collaboration, cooperation, sharing knowledge. Okay, but not too much close that we cannot do our work properly. Example, your colleague is doing harm to the patient. If you have very close relationship, you will not say no. You will not say stop. So it will be difficult. Good relationship or good communication skills, you can still tell them stop. You can still communicate with them and maintain good relationship. Okay. Then continuing competence, same. So we are observing ourselves. We are renewing our BLS, ACLS, our competency. We are learning the skills. We are practicing them. If we have any deficiency in our skills, we try to improve. We are attending the courses, continuous education, CME, and also you help others to have their competence. So you are preceptor, so you are training new staff. When you have preceptee with you, you are training them to have the competence. Also you heard about peer review. So this you help your colleague in evaluating themselves. And also ethics. Ethics is the pillar for nursing, because you are very close to the patient. Easily, by any negligence, you can harm the patient. So we have to know the code of ethics, the patient right to autonomy, confidentiality. Don't share the patient information with anybody who is not related to the care. Respect, culture, safe practice. So you know what's accepted for this patient culture. Some patient culture, maybe you have to call by this name, first name. No, other patient, no, you have to call by second name or family name. So you have to understand the patient culture. Also leadership. How can a bedside nurse practice leadership? Leadership is not only being giving assignments or making rota. No, leadership include being role model, advocate for your patient, provide direction and delegation. Example, when you have admission, all your staff, all your colleagues are helping you. You are the leader in this situation. You can give them tasks and assignment. You can ask them to do this job. You manage the situation. So that will be your role as a leader. Collaborate and provide support. You also help your colleague and resolve conflict. Your ability to resolve conflict peacefully and constructively without damaging relationship. Because if we are not able to resolve conflict, you damage relationship. And we stay with our colleague and our in the hospital longer than we stay with our family. So, and even why is also not only the hours, but when you wake up every day, if you have day duty or like this, you have full concentration. But when you go home, you have 50% concentration. So if you think about it, the more conscious life, the high consciousness, higher thinking, the more interaction and emotions is more detailed with work for nurses especially than home. So it's very important to have positive relationship with your colleague. Management of resources, disposable and reusable, and machines. All of these things we use as nurses. We can be wasteful, so you are waste the resource, or you can be resourceful, so you are saving the resource using in an efficient way. So you should use your resource to provide the good care. Yani for example, when you clean, when you give medication, you must use alcohol swab. This is the minimum. But don't use 15 alcohol swab, right? So you know this is needed, and not below that or above that. So this is. Some people say no, I will not. I will save the resource. I will not use alcohol swab. This is not good, right? This is actually will cause harm, and the patient will have complication, and he will cost more to treat. Also resources including machines. So when you deal with machines, equipment, you have to know how to use it in a safe way. But for example, if you are opening an infusion pump door and you close it in the wrong way, it will break. It will cost thousands to repair. You didn't mean to break it, but you didn't learn how to use it. This is your problem. The problem is not that you don't know. The problem is that you didn't try to learn before. So we have to learn our equipment, whatever in our environment, so we'll deal with it in an efficient way. And this is my references, and if you have any questions, please ask. Thank you very much.